few points which is communicating the luvo connecting point from one organ to other organ. Whereas in here, the group luvo points indicating there are the one particular organ is communicating to the three meridians. One particular point to be communicating to the three meridians. In the similar way, we do have the points are collectively 4 points which can be integratedly communicating to entire system of the body. That is the key over here. But now we look into the one point to be known as a Qian Shi. Remember, this is the Qian Shi where all the 4 points are located. Right? So, वो point और दूसरा pericardium 5 is the point to be known as a communicating to 3 in organs of the hand. So, those organs are known as a located 5 chun proximal to the, 3 chun proximal to the ventral wrist crease, midway between the palmaris longus and flexor carpi radialis tendons, right? Where the pericardium 6 is located, that is 2 chun, but this is 3 chun proximal to that. The second point to be known as a sun, yang, lo. Sun means is 3, yang ka matlab yang organs, and luvo means is the luvo connectivity. 8, right? The another point to be known as a this particular point, I think मैंने practically आपको दिखा देता हूँ. There are the 4 points of the mark में रख लीजिए. So that will be really useful for the day-to-day clinical practice. Yeah, thank you. Who is coming over here? Ajo. Now I am showing you one single particular point. This point to be especially treatable for there are the 3 points. 3 meridians are communicating on the single meridian. Now he got kind of the vibration that indicating, that vibration is indicating for what condition? But especially that point is located on the medial now. That point is located on the medial now. Just apply surface level. You just take a deep breath. Yes. So this point is communicating to how many meridians? Lungs meridian, pericardium meridian, and then heart meridian collectively. That point to be known as a Qian Shi. That is angio P5. This is the pericardium 5 point. Then you look at about this angio 8 point. So this you just use it the another meridian on the triple warmer meridian. Now you look into the 3 plus 1 chun, 4 chun proximal to the ventral. This is the ventral wrist crease. This is dorsal wrist crease midway between the radius and ulna. So this particular point is treatable and communicating to all the 3 yang meridians. Those meridian is known as a large intestine, and then triple warmer, and then small intestine meridian is communicating point. The name itself is indicating sun, yang, lo. Sun means 3, yang means is the fu viscera, luo means is the pathway or connectivity. So now hopefully we understand 3 plus 3, how many meridians were completed? 6 meridians were completed. Now the another 2 points are located on the another 2 points are located on the foot region. So those points are known as those points to be known as a spleen 6. Spleen 6 is the spleen, liver, kidney regulating point to be known as that is sun in chio. This is sun yang lo. That point to be sun in chio. Spleen 6, sun means 3, in means is the zang viscera, and then Chio means are the junctions or the communication or the junction to communicating spleen, liver and kidney. So whereas in another point on the same direction on the dorsal region, you just understand this point to be known as a GP39. That point is 3 chun proximal to the 3 chun above from the lateral malleolus midway between the 2 tendons peroneus longus and peroneus brevis tendon to treat an influential point for the bone marrow as well. By the way, that particular point is treating for the 3 yang meridians. Those meridian is gallbladder meridian itself is the point is located, gallbladder, and then stomach, and then vesical meridian or the urinary bladder meridian. Now you look at about the spleen 6 is the in viscera, this is the fu viscera, here is the 3 in viscera, the 3 fu viscera. Collectively 12 meridians are communicating point to be known as the entire body to be collectively treatable by using the 4 points, those points which you understand right now. There is another point is the topmost point to communicating to the entire system of the body. This is in fact is communicating to all the meridians. At the same time is one point is communicating to collaterals. That's point to be called as a spleen 21. Where exactly the point is located? This is the center of the axilla region. The center of the axilla, the point is known as a Chichuan. Right. So now you understand this is the 4th intercostal space, and below vertically below this 5th and 6th, and this is the 6th intercostal space. The point is located here is spleen 21. So there are some authors write the point is located on the 5th intercostal space. Some authors believe it is on the 6th intercostal space. But however, the point is vertically below. Exactly this point is located. Especially we can apply right or left. But it's better you just apply on the left side is more good, because the spleen denotes which is located on the left region. Better we can activate. When you wanted to remove this, and just you remove it off and give the pressure on that region if you are applying on the cloth. When the on the cloth you don't know whether it is bleeding or not, but make sure to press that particular point for a minute. At least that can prevent the further bleeding, right? So thank you. If anything, do you have any doubts, and please let me know.